Hello mamas, this is a video for your second and third trimester. I'm Dr. Bree and I support the pelvic floor. I'm here to give you a great core workout that's quick. It's going to mobilize your body. It's going to get you feeling a little more comfortable. Things start to feel less comfortable in the second and third trimester. Our posture is really starting to get thrown out of alignment since baby is growing so much. But the good news is a lot of us feel a little bit less nauseated and maybe even a little more energetic after that first trimester has passed. I know for me, I had pretty bad morning sickness in the first trimester and was starting to feel a little better, especially in the second trimester. Now, as with any exercise routine ever, don't do anything that makes you feel uncomfortable or painful. Certainly follow your healthcare provider's advice about your particular needs in pregnancy, but most of these moves should be just fine for you as long as you listen to your body. So let's begin with hands behind head hip circles. So you can put your hands beside your head or behind your head as long as your head doesn't get forced forward. I like to put my hands actually more beside my head. So hip circles are a really, really wonderful move that is great for your digestion. As you move into the second and third trimester, a lot of times people experience constipation, sometimes heartburn, things like that. And this move helps just sort of massage the internal organs and massage baby. It's also really strengthening the muscles that are going to help you prepare to give birth and to recover from birth as well. So it's great for the internal organs and it's great for your muscles and joints as well. So you're just doing a circle with your hips, like you're drawing a circle on the ground beneath you, feeling it wake up the abs and the low back, starting to really also even wake up the pelvic floor a little bit. Go the other way with your hip circles. Again, this is really just a warm up. Now, if you have a stability ball, a yoga ball, we're going to use that for some of the moves. So have that handy. Keep going. Let's do 5, 4, 3, 2, and 1. And before we get to that though, let's go ahead and do some plies. So continuing to kind of warm up this core of our body, bring your legs out to the side, nice and wide. Feet and toes are tracking out and so are your knees. Don't let your knees fall in. We want to have them tracking right out over your feet. So keep your spine really long. Try not to tip forward. We're lifted through the pelvic floor, pulled in through the low abs, and we squat down and exhale up. Now you can adjust your feet and knees so that everything feels really comfortable, but down, opening the hips, and then exhale up. Feel as you come down and then exhale up, that you're activating those inner thighs and the pelvic floor as you exhale up. So again, release and then lift. Feeling the inner thighs and the pelvic floor lifting up and then release down and lift as you exhale. Let's just do 4 more. 4, 3, 2, and 1. So it's really important to keep that lower body and the lower core strong. We're going to need that strength as you have a new baby around the house. You're doing all that lifting and car seat carrying, all of those things. So let's go ahead and move to a wall. This is a wonderful exercise for mobility and stretching out the front of the chest and also strengthening the low belly and the low back. So I want you to begin by making sure that your belly isn't arching away from the wall. Your low back and your belly aren't arching too much. Press it toward the wall. It doesn't have to be completely flush to the wall, but it should be pressing back toward the wall. So again, no arching. We want to be in. Now in this position, your feet might need to walk forward a little bit. That's okay. We're going to bring the arms up overhead and then touch the fingers. Try to keep the elbows close to the wall. And again, keep those low ribs in and keep your low back close to the wall. Don't let it arch. So this is strengthening the core gently and also mobilizing the shoulders, opening up the chest, making sure your posture is really something you're thinking about right now, because it's so easy to hunch forward after we have our baby. We're spending so much time carrying and nursing and all of the things that are forward. So this opens up the front and strengthens the muscles of the back to prepare for this beautiful, amazing endeavor you're about to go through with having a new baby. So a couple more. You're going to want to really breathe with this and feel the strength in your core, the strength and mobility in your shoulders, and the opening of your heart. Let's just do one more. So again, opening the heart, strengthening the back, feeling that gentle strengthening of your core, and then let it go. Whew, roll those shoulders back. Okay, come over to a chair if you have one handy. So for this chair move, you are going to do a plank from a chair. So again, still gently strengthening that core. Now you're going to want to make the chair be flush up against a wall or in some other way so that it's not going to move on the floor. I don't want you to lose, the chair across the room. So make sure your chair is really stable. Ultimately, it's up against a wall. In this position, you are going to, so in other words, don't do as I do right here. So in this position, you're going to find that perfect plank position where your hands are on the chair. Make sure you're lifted through the pelvic floor and pulled in through those low abs. So your body's straight like a plank and you're not like this, and you're certainly not like this. So your body is like a plank. In this position, strong belly, lift the pelvic floor, pull in the low abs, and bring your knee up toward your elbow as you breathe. So exhale, knee toward the elbow. It does not have to touch. This is a full body workout here. Feeling this in your core, feeling it in your arms, in your back. Let's do 4 more. 4 and 3 and 2 and 1. Now same thing, but try crossing knee toward opposite elbow. It does not have to touch. This is going to activate your obliques very gently. And we're just going to do a few. We don't want to go crazy with core work when you're pregnant because we really want to spend a lot of the time focusing on letting go, learning how to release these muscles just as much as you're strengthening them gently. You're also learning how to let go. So let's do 1 more each direction. Exhaling as you bring that knee toward the opposite elbow and then walk your legs forward and round it up. 1 more arm strengthener because again, we want to do more opening of the chest and strengthening the arms. You're going to be working a lot after baby. So you're going to sit toward the edge of the chair. Hands are on the edge and come forward, just little tricep dips. Exhaling as you press your arms straight. Exhale, exhale, exhale. Just 8 more. 8, 7, 6, 5, 4, 3, 2, and 1. Okay. That was pretty much it for our more hardcore strengthening moves. I want you to grab your ball now if you have a ball. And we will do a little more strengthening here, but we're also going to be working on mobility. So if you have this ball, I'd like you to place it behind you. So you actually have it behind the small of your back at the wall. Move it over just a little bit. Now walk your feet forward, and you might have to play with foot position here, but we're gonna be doing a little squat session. So again, this is some strengthening, but we're also gonna be working on mobility as I'll show you in just a minute. So feet are forward. It's kind of like they're maybe, I don't know, they're just forward of my knees, maybe about 6 to 8 inches, and I can play with the position later as I go down if I decide that it's not quite right. So what I'm gonna do is I'm gonna squat down, knees are over the feet, and everything's pointing straight ahead. Coming straight down, allowing myself to press gently into that ball behind me. And I wanna come down all the way so that I'm almost at a 90-degree angle at my hips and my knees. and super strong through the quads. Now lift the pelvic floor, pull everything gently in, and exhale up. So come down, release, come all the way down. Feel those quads fire up, the glutes fire up, and the pelvic floor lift as I exhale, up. Now, again, adjust your feet. Maybe they need to come forward a tiny bit. You just want it so that your knees are over your ankles when you're down low. So holding it. Now lift pelvic floor, use those quads and glutes, and exhale up. 2 more. So we're not doing many of these. So come on, down, 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 down. Use the quads, use the glutes, lift the pelvic floor, and exhale. Last time, come down. Quads, glutes firing up, lifting pelvic floor, exhale. Now, this time I want you to come to just a soft knee position. It doesn't have to be that full squat. And I'd like you to feel that ball pressing into your low back and let your pelvis, your tailbone, curl under the ball. So you're allowing that arch in your low back. Now I want you to press your low back into the ball and you're tucking your tail under. So it's like your pelvis is going forward into an anterior pelvic tilt, and then you're pressing your low back into the ball and your pelvis is going into a posterior pelvic tilt. So an anterior pelvic tilt and then a posterior pelvic tilt. So let your low back arch and then exhale, press your low back into the ball and tuck your tailbone under. So all of this mobility should feel really nice, especially if you have low back pain, because you're supported the whole time by the ball. You're not ever just sort of hanging out in space. Even in this arch, you're supported by the ball. And then as you tuck your bum under and you lift your pelvic floor, pull belly toward the spine, pull baby toward the spine. As you're doing that, you're also pressing into the ball and stretching those muscles that tend to get so cramped and tight when our posture changes due to pregnancy. So mobilizing the low back in this way is strengthening your pelvic floor and your low abs. And it's also releasing the muscles that get tight in the low back. And it just should feel lovely. So do a couple more of these. Again, I'm going to walk you through one more time. As we arch the low back and we're supported by the ball, you can feel that mobility. You can feel a little bit of a stretch in the front. And then now, as we tuck the bum under and press our low back into the ball, and then our pelvis tucks under, you feel the pulling in of the low abs and the lifting of the pelvic floor and the stretch of those low back muscles that tend to get so kinked up when your back is kind of arched due to pregnancy. All right, go ahead and stand up. We are going to release the ball down to the ground and wrap up with some seated hip circles on the ball. Now, in this position, you are simply going to circle your hips just like we started with. So think about drawing a circle on the ground beneath you with the ball. It's making some noises. If your ball is making noises too, that's okay. Couple more times. The ball adds a little bit of lack of stability, so that's nice for strength. But it's also nice because it provides feedback the whole time. You're sitting on a surface and you can feel that ball pressing up into your perineum, into your pelvic floor, and you can kind of feel what's happening in the pelvic area when you're circling around on the ball. Okay, finish up here. And then in this position on your ball, sit up nice and tall in the middle. Bounce a little bit so you kind of get a sense of your balance. Of course, you can also do this just seated in a chair, this next move, or you can also do it lying down on your side, but we're simply gonna do some Kegels. So Kegels are where you lift the front and back passages, so squeeze and lift the front and back passages, or the openings. So the urethra, the vagina, and the anus are all surrounded by these muscles. So we're going to squeeze off those openings and lift toward our head. Now the focus, what we really want to focus on the most is actually the release. That is so important for pregnancy and for preparing to give birth. I want you to focus on the release more than anything. So go ahead and squeeze off those openings, squeeze and lift, Pull them up, up, up toward your head. And then really focus on the letting go. Now again, if you want to experiment with different positions, try lying down on your left side. That's a really great position for this stage of pregnancy. And it's actually often a little easier for people to feel the contraction when they're lying down because they're not fighting gravity. So try lying down on your left side if you'd like to, but I'm going to do a couple more here in this seated position, squeezing and lifting, closing off the openings, and then fully releasing. Try not to let your glutes, your butt muscles, be the main squeezers. You really want to feel this on those inside pelvic floor muscles. I have a little model that I'll show you. So they're right here. This is the inside of the pelvis. And then here's a view from underneath. So this is what we're going for, is these muscles right here. And here's a view from the inside. These muscles are the ones we want to squeeze up and then fully let go, because these are the muscles that are going to have to release in order to allow the baby to push out when you're in delivery. So go ahead and wrap up your Kegel exercises, and just know that Kegels are a wonderful thing for you to do to help prevent bladder leakage now during pregnancy and also after you give birth, but you must focus on the release just as much as the contraction. It is so important. And for many people, you don't need to do hundreds every day, maybe just a few. Talk to a women's health physical therapist if you have specific questions about your needs, but know that they're a great exercise for most people. Just be sure you don't overdo them. Right now, we really want to be focused on mobility as well as that strength, and the release as well as the strength. All right, go ahead and finish up with a very, very gentle twist. So again, you can do this seated in a regular chair if the ball is too unsteady, but I want you to sit up nice and tall, and then exhale just a very, very gentle twist to your right. You can put your left hand on your right knee. Make sure though that you don't twist too hard. In pregnancy, you want to avoid a super deep twist like this. Just make it a very, very gentle twist where you're just looking a little bit diagonal rather than all the way over your shoulder. Too much twisting is hard on the baby and the blood supply, so we want to make it very gentle. But a nice gentle twist is good for digestion. Go ahead and inhale. Look forward on an exhale. Then inhale nice and tall and twist the other way. Again, very gently. Exhale, tiny gentle twist. Not more than this diagonal here. Again, we don't want to go too deep. That's too much for pregnancy. So nice gentle twist. And then our last move is simply going to be a thoracic stretch. Now, I like to do this on a ball since I have a ball, but you can also do it up against a chair, or I can show you an alternative as puppy pose is a nice alternative too. But this is a really nice way to just stretch out the upper body and the hips. You can bring your feet together, your knees apart, sit back on your heels, and then just bring your arms forward. Like I said, I love using the ball because you can actually rock side to side. And I'll tell you just a few more things as we're stretching here. Again, an alternative is to do this up against the seat of a chair, or you can do puppy pose, which looks like this, with your hips directly over your knees and then your hands forward. But I'm going to show you again on this. So as you continue this stretch here, or whatever feels good, I'm going to go ahead and wrap up by just telling you a couple more things. So the first thing is, if you experience round ligament pain, which is that pain deep in your pelvic area, it can happen oftentimes when you're walking around or doing something a little bit more strenuous, like an exercise routine. You might want to use a band to help support, a pregnancy or maternity support band or belly band to help support underneath your baby. And you can usually find someone to help you get fitted for something like that. It can be really, really helpful when it comes to pain. The other thing is, you do want to continue to exercise and move your body throughout your pregnancy as long as it's feeling good. But watch for signs of overexertion. If you feel that you need to break up your exercise session into 2 sessions every day that are shorter, that might be a good idea rather than doing one long session. So maybe instead of doing a 30 or 40 minute exercise session, you can do 2 15-minute sessions. And that way you'll be able to maintain your fitness throughout pregnancy. So important, but you'll never be overdoing it. Just be sure that you're able to maintain an ability to talk throughout your exercise routine. That's really important to make sure that you're not overdoing things. And lastly, of course, warning signs to discontinue exercise include vaginal bleeding, severe shortness of breath, painful contractions, major swelling in your legs, especially if it's only on one leg, and anything that makes you just feel like you're uncomfortable or that something is off in your body. Listen to those signs. It's so important. So I wish you the best in your pregnancy. Remember that you are trying to focus, especially on the second and third trimester, focus on gently strengthening the core to help protect your back. I know that a lot's going through, your body's going through a lot with the postural changes. So you definitely want to support your core. You want to support your body with a strong core, but you also want to focus on the release, the letting go, and the gentle mobility. It's going to help with your digestion. It's going to help you ultimately with recovery after you've given birth. And being sure that you're not overly contracted is going to allow for a more smooth and easy labor and delivery. So focusing on the strength, but also the release is key. I wish you an incredibly stress-free, discomfort-free, and happy rest of your pregnancy. Enjoy this time before your new little bundle of joy comes, because you're going to be busy afterwards, but it's going to be so worth it. So please, mamas, have a wonderful rest of your pregnancy. Keep moving, eat clean, move every day, and you will shine brighter. I will see you next time. And check the video notes for links and resources that might be helpful for you now and also after you have given birth and after you're recovering and ready to get back into core fitness again. I've got resources for you. I will see you next time. Bye.